Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. If someone suddenly becomes unconscious right in front of you, would you know what to do? What if your child was playing outside and hurt himself badly and is bleeding very heavily? Would you know what to do? On today's episode, we will be learning about first aid and CPR, which is Cardiopulmonary Resuscitation. It's very important because you never know when you will be in an emergency, and what you know about this will save somebody's life. So don't go away, stay with us. Let's watch and learn together. As is our usual custom on the Health Zone, we're going to go out to the man and woman on the street to find out if they know what to do in different kinds of emergencies. So don't go away, let's watch the video together.
Today we will be talking to the man on the street. What should you do for somebody who is having a convulsion?
I think I'll pretty much take him to the next nearby hospital.
Convulsion, I think there is some spiritual things to it.
Okay.
So I think it's just to leave the person for a while, get water to suit, maybe to sprinkle water on the person's face, and see if he calms down. Try and sit him down, then give him fan him so that he gets fresh air, I think.
You grab a metal spoon into the person's mouth, not to allow the person to gnarge his teeth together.
What would you do for somebody who has just suffered a burn?
First thing is to get egg, break it on the affected area, try and apply.
The first thing we did was to add palm oil.
I think that's a hard one, but I think the best bet is still to take him to a hospital. Yeah.
Welcome back to the Health Zone. That was really interesting what the different men and women on the street had to say about emergency situations and what to do. Well, today's episode is exactly what we need. It's going to be a lot of fun. We're not going to do a lot of talking. We're just going to watch a lot of demonstrations to learn things that we can do in various emergency situations to help someone who's suddenly injured or suddenly ill. But first, let's define some terms. What is first aid? First aid refers to the medical attention that is usually given immediately after a sudden illness or injury occurs at the location where it occurred. It is usually a one-time, short-term event, and it doesn't really need a lot of technology or skills to administer. It's the initial help given to an injured person until expert medical help arrives. And the goal of first aid is to prevent further injury, to preserve life, and to promote a quick recovery. Now let's talk about CPR, Cardiopulmonary Resuscitation. It is a life-saving technique useful in many emergencies, including heart attack, stroke, near drowning, when somebody's breathing or heartbeat has stopped. Do you know that most people who experience cardiac arrest at home, at work, or in a public place die because no one around them knew how to perform CPR? So why is it important for us to know how to do CPR and first aid here in Africa? In most of sub-Saharan Africa, we don't have any functional healthcare systems, much less a trauma care system. In developed countries, you can call 911 and an ambulance comes. We have no ambulance services, and we have long waiting times in emergency rooms in the hospital. In fact, it is said that sub-Saharan Africa is the most dangerous place in the world to fall ill or to have major trauma. So we are going to learn exactly what to do to save a life today. Stay with us. If someone is choking, they usually cough to try and dislodge the object that's choking them. If they're coughing, that's a good sign. You don't need to do anything. Let them cough until they dislodge the object. However, if someone who's choking is not coughing or unable to speak, that is a medical emergency and you must act quickly. Take permission from the person to help them. Can I help you? Bend them over with your one hand diagonally across the chest. Bend them over at the waist. And then using the heel of your hand, give 5 back blows between the shoulder blades. Then you straighten them up. If they're still choking and unable to speak, you step behind them and you follow those back blows by abdominal thrusts. Use 2 fingers to find the belly button and then take your other hand and make a fist right above those 2 fingers. Grab that hand with your other hand and give 5 quick abdominal thrusts upwards. 1, 2, 3, 4, 5. If that doesn't dislodge the object, you repeat the whole sequence again, and you continue to repeat the sequence until one of 3 things happens. Either the object is dislodging, you actually see it come out of the person's mouth, or the person starts to cough and is now able to speak, which means they are getting better, or the person becomes unconscious because the object is still not dislodged. If the person loses consciousness, at that point, you check for breathing, check for heart rate, and then perform CPR if necessary. I will now repeat the whole sequence again. Watch carefully. Can I help you? Excellent. You saved your friend. You just saved a life. Well done. If a child is choking, you repeat exactly what I did with the choking adult, with the child, with 2 main differences. With a child, depending on how small the child is, you may need to kneel behind the child to perform the back blows and the abdominal thrusts. The other difference is that you try not to use too much force with a child. Don't use as much force as you would with an adult. You're trying to save the child, not kill the child. So a bit more gently than you do with an adult with the back blows and the abdominal thrusts. I will now demonstrate what to do with an infant who is choking. And by infant, I mean a child 12 months and younger. When an infant is choking, they act unusually, cry, cough, or may turn pale or slightly blue around the lips. If the baby is coughing, that's a good sign. It means they're trying to dislodge whatever is choking them. Let her continue to cough until the object is dislodged. If a choking baby is not crying, not breathing, or not coughing, that is a medical emergency and you must act quickly. If the child is with a parent, get permission from them to help their child. Observe to see if you can see what is causing the child to choke. If you cannot see anything, begin resuscitation immediately. Support the head of the child with one hand, and supporting the child on your forearm, place the child on your thigh, head down. It's important that the child be head down so that as you perform the back blows, if the object is dislodged, gravity and your back blows helps the object to be dislodged and it falls right onto the floor instead of back into the child's throat. So 5 quick back blows between the shoulder blades. 1, 2, 3, 4, 5. If the object is not dislodged and the child still cannot cry or breathe, put the child face up, head down, supported by your leg or your thigh, and then do the chest thrust. With the adult, we did the abdominal thrust. With the child, also an abdominal thrust. But with an infant, it's chest thrust. 2 fingers. Locate the baby's nipples and draw an imaginary line between the 2 nipples. Midway between that, on that line, in the middle of the breastbone, is where you want to perform the chest thrust. 1, 2, 3, 4, 5. If the object is still not dislodged, have a quick look to make sure there's nothing in the baby's mouth in case the object came out. And then repeat the sequence again. Support the baby's head, face down. 1, 2, 3, 4, 5. Nothing is out. Back up. Check if there's anything in there that's dislodged. If nothing, head down, supported by your thigh, and 2 fingers, 5 chest thrusts. Make sure you're thrusting at least ½ inch to 1 inch down. You really want to try and push so that the object gets dislodged. And you continue to repeat the sequence until either the object is dislodged or the baby is crying and coughing, which means baby's better, or the baby is unconscious. If the baby is unconscious, check for breathing and circulation, and if those are absent, begin CPR. If your child or a coworker or a neighbor sustains a wound that is bleeding profusely, there are some basic things that you must do, and I will demonstrate that right now. The first thing you want to do is you want to make sure that there is no foreign object, such as a stone or a piece of glass or a pebble inside the wound. And once you note that there's nothing inside the wound, put pressure on it immediately. When you put pressure on it, it's not 2 fingers or grabbing it like this. What you want to do is with the flat of your fingers or with the heel of your hand, you put pressure on it. And the point of putting pressure on it is to stop the bleeding. And you keep pressure on it for as long as it takes for the wound to stop bleeding. It's important that you elevate the part of the body that's bleeding. So don't leave the person's arm hanging down, because then gravity makes the blood pump out further there. So you want to lift the arm up. So put it on a table like that, and then that's what you want to do. Okay? So you don't want it to be here where it's lower than her heart or hanging down. You put the pressure on and you do something like that. So you elevate the limb and you keep the pressure on for as long as it takes. If you check it and it's still bleeding, as you can see, there's still blood, you can add more gauze pads to stop the pressure. Now, as you can see, I'm using gauze pads here. I'm a doctor, I have these things lying around. But you're at home and you don't have anything like a gauze pad. A clean cloth will do. Any clean cloth will do. And you can use that as pressure. Keep the pressure on until the bleeding stops. If you find that your arm gets tired of putting the pressure on, if you happen to have a bandage, you can use that. What you do is you wrap it very tightly around the wound to keep the pressure sustained. And that's all you need to do. And then get the patient to the hospital as quickly as possible so that stitches can be placed if necessary. So you're standing at the bus stop in a queue in the sun for what seems like hours, when suddenly in front of you, a woman slumps over and appears to be unconscious. What do you do? Watch. The first thing is to look at the environment to make sure it's safe. And you go, ma'am, are you okay? Are you okay? She doesn't appear to be responding, but her chest is rising up and down, so she's clearly breathing, and her heart is okay because she's breathing. And so at this point, there's really nothing for you to do. It seems as though she has simply fainted from standing in the sun for too long. And so what we're going to do to help her is just to help get the blood back into her brain. And to do this, we elevate her feet. We raise her feet higher than the rest of her. If there's a chair or a stool nearby, or a piece of wood, something you can place her feet on to elevate them. Or maybe another person standing in queue can be kind enough to kneel down and you put her feet up on that person's knees. And at this point, you simply leave her. You don't need to pour water on her. You don't need to pinch her or slap her or fan her. This position will get the blood going back into her brain, and in a few minutes, she'll regain consciousness. Great job. You saved another life. So you come upon somebody who's unconscious, or you're at home with a family member and they suddenly slump over and they're unconscious. What do you do? The first thing is you make sure that the environment is safe, because if it happens somewhere where if it was the result of an accident or something, it may not be safe enough for you to go and attempt to do rescue CPR for the person. And so you assess the environment, make sure it's safe, and then you begin CPR. So what you do is you tilt the head and then you listen for breathing for 10 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. That's 10 seconds. He's not breathing. So you start CPR right away. The imaginary line between the two nipples, midway on the breastbone, put the heel of one hand immediately below that line. Lace your fingers through the fingers of that hand. You want your shoulders directly above the person. And then you want to begin chest compressions. At least compress the chest at least 2 inches. And you want to do 30 compressions and then give 2 breaths. You want to do it at a rate of at least 100 beats per minute. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 2, 3, 4, 5, 6, 7, 8, 9, 10. So those are the chest compressions. It's important that in between compressions, you allow the chest to come all the way back up before the next compression. So don't keep compressing. It's down and you release, down and release, down and release. That's what a full compression is. So now we will focus on the breathing, and then we'll do it all together and you'll see how that works. For the breathing, you tilt the head back a little bit and lift the chin to open up the airway. You pinch the bridge of the nose, and then you make a seal with your mouth completely over the person's mouth. And then you give 2 breaths. Each breath should last about a second. And you want to watch to make sure that the chest is rising so you know the air is actually going into the lungs. Those are 2 rescue breaths. And then you immediately go back to chest compressions. 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. That is CPR. So that is sequences of 30 chest compressions followed by 2 rescue breaths, back to 30 chest compressions, 2 rescue breaths, and you keep going until some things happen. Either the person starts to moan and move around and you know you've resuscitated the person and you get the person to the hospital immediately, or somebody comes to help you because you're tired of doing the chest compression. So another rescuer comes to help you. Or something called an automated external defibrillator is available. That's the AED, automated external defibrillator. Not everywhere has it here. And so if that's available, then you get it and you shock the person. I'm sure we've all seen that on TV and movies. That's what that is. Or experienced emergency helpers show up on the scene to take over from you. So those are the only reasons that you stop doing chest compressions and the rescue breathing. That is cardiopulmonary resuscitation, CPR, the traditional way. So for infant CPR, you are doing the 2 rescue breaths first, then 30 chest compressions, 2 rescue breaths, back to 30 chest compressions, 2 rescue breaths. Make sure that the baby is on a firm, flat surface. And then, like I said, you give 2 rescue breaths. You use the palm of one hand to tilt the baby's head back to open up the airway. For babies, because they're small, you will make a seal over the nose and mouth together with your entire mouth. And then you give 2 rescue breaths. Lift up the chin. Seal the nose and mouth with your mouth. Make sure you see the baby's chest rise. And that's what I just did. Again, we'll do that again, just so you see. And then you begin CPR. 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you continue to do CPR for the baby until either the baby starts to moan and cry, in which case you've been successful, or somebody else comes to help you, or a trained medical personnel shows up to help you, or the baby continues to remain unconscious, in which case you will continue chest compressions until you can get the baby to the nearest hospital. That is how you do infant CPR. I have one last question for you. If a child drinks bleach or kerosene accidentally, should you make her vomit? The answer is no. This can cause more damage as the vomit leaves the body. Instead, get her to sip cold milk or water if she has burnt lips from what she drank, and get her to the nearest hospital as quickly as possible. I hope that you feel more comfortable about performing first aid and CPR after the demonstrations today. Remember though, take a safety course through the Red Cross or educate yourself. You can not only avoid trauma, but you can also give life-saving help to someone in need. Most of all, know that by keeping a clear head and staying calm, you can really be the difference between life and death for someone who has been injured or is experiencing a medical emergency. This has been Dr. Toju, reminding you to stay healthy.